Good afternoon. This is my father, Mr. V. Venkatachalam Iyer, and he has been suffering from hemorrhoids for the last 40 years. He was operated 40 years back at Sossoon. Afterwards, off and on, once in 6 months, he used to have the bleeding and prolapsed piles, and then he wasn't willing for surgery. But about 2 weeks back, on 17th of April, he had torrential bleeding. There was no prolapse, only when he went to the toilet, he showed me he just had only bout of bleeding everywhere, the blood was splattered. So twice or thrice in a day, 4 times he had, and I did a hemogram. It was around 8.5, and then I was really scared. And then I know Dr. Porwal and Healing Hands Clinic for the last 5-6 years, because I was president of Indian Medical Association, and we have heard about his latest techniques of surgery. So I messaged him regarding his condition. He told me you can come over immediately the same day. So I came here, brought him, and then he checked it. He said the bleeding is there from the prolapse, but it is inside. But we may have to do a colonoscopy and then do the pile surgery. Since he was losing lot of blood, I said, can we do the surgery before? So the same night, the stapler surgery was done for the piles, and he recovered, and we were discharged the next day morning. So we went back, and for 2 days he didn't have any problem. And then from Monday, that means after the 4th day, he started passing lot of clots, no fresh bleeding, and his hemoglobin also dropped, and he started feeling giddy. So I brought him again to Dr. Porwal on 23rd, and he took lot of efforts. He also saw a lot of clots were there. He suspected some bleeding from above, not from the piles. The pile site was not bleeding. So he did a colonoscopy, we did CT, angio of abdomen, and everything was done, an empirical management with pause MF and fresh frozen plasma, blood, everything was given for 3-4 days, and he settled with that, and there was no active bleeding for 48 hours before he was discharged. So we are very, very happy with the treatment we received, and we are very, very grateful to him that Dr. Porwal took risk of treating my father, who was above 90 without and he didn't tell us to rush to ICU or anything, and he did a good job. And I'm being a surgeon myself, I appreciated his efforts a lot. I am forever indebted to Healing Hands Clinic, and thank you very much.